How many times have we gone back home to realize that there has been a swelling around your ankles or in your feet? It happens quite often. I'm sure you will realize that this is not something which is a one-off occurrence. It happens practically every day to most of us. This is primarily because the blood which is circulating down into the foot is not able to go out of the legs again, and it stagnates or pools, collects, वहीं इकट्ठा हो जाता है जहां पर हमारी एंकल के पास ब्लड कलेक्ट होता है, especially at the end of the day. You get up in the morning and you're absolutely fine. There's no problem, as if nothing has happened to you. As the day progresses, as you keep sitting, standing, working at your desktops, the leg swelling increases more progressively, and at the end of the day, the whole leg is swollen. So this is one of the most important presentations of swollen leg syndrome. There are a variety of reasons for this. This isn't something which is just purely mechanical. It is and can be seen or sort of becomes more prevalent in people who do not walk, cannot walk, do not like to walk, are just plain lazy, or just sitting and working on their desks or tabletops all day. So that is what causes the swollen leg syndrome. Now, if you really have a lot of swelling and it's been going on for a long period of time, then this swelling can be reduced by elevation. When we talk about elevation, elevation means that it has to be, the ankle should be at least about 12 inches away off the bed, so that the blood can actually drain back towards the heart, and that is what reduces the swelling. So leg elevation by keeping the legs up, sitting and standing, sitting and working with your legs straight out, and of course trying to walk as much as possible, because walking causes contraction of the calf muscles, and this pushes the blood from below upwards. Number 2 is a pair of stockings. These are medical compression stockings. These are tight stockings. They're not easy to get in and out of. In fact, one does see people who come and say, oh, I bought these stockings 3 years ago or 5 years ago and they're just good for me. The simple test to assess whether the stocking that you're wearing is good for you is that wearing and removing the stocking should not be easy. It should be a little effort should be required to pull up the socks, and a little effort should be required to take them off. If you can easily take them off or easily put them on, those stockings are of no use for you. So this is the way simply by which you can actually prevent swelling in your legs. The best way to look for the cause is by doing an ultrasound Doppler examination. The same ultrasound machine which looks at your stomach for your stomach's, gallstones and uterus and other things, the same ultrasound machine can be used to assess the function of the veins or the position that the veins are in the legs. And if they are blocked, they need to be treated by blood thinners or by emergency treatments by which you can remove the clot and push the blood and start moving the blood circulating again. If there are varicose veins, these need to be treated. If they are big and large, then laser treatment, radio frequency treatment, or mechanical chemical ablation treatment, or glue treatment, any of these, depending on the condition, in a pure selected cases basis, this can be done as a permanent treatment for varicose veins. For people who have spider veins, very tiny veins, there's no discomfort because of them apart from just the cosmetic angle. These also can be treated these days with either radio frequency ablation, a special machine, or by using a medicine which can actually close off these veins and make them disappear. So there are lots of treatments depending on the cause, and that is what needs to be identified by a well performed Doppler examination in the sitting and standing position. That is the most important part of the investigation. So if you diagnose the condition, it can be treated, and all practical purposes, near permanent control of the leg swelling can be achieved provided the diagnosis has been ascertained. Thank you.